Good morning, everyone. I think I've no idea if this is on or not. Good morning, everyone. Just about. It's still the morning. We running a little bit behind schedule, but that's the new schedule. So welcome to all of you to this parallel session on implementation science, translating research into action. I am Magdalena Skipper, Editor-in-Chief of Nature, and it's my real pleasure to be moderating this session with a fantastic set of panelists. I will introduce them in a minute. And so I will start with a very brief introduction to this session, and I will be a little bit provocative deliberately, and I will say that you have just joined the most important session of this two-day event. Oh, thank you. So several times yesterday, we heard that studies documenting implementation and evaluating the impact are scarce. It goes without saying that such studies are important, so the scarcity begs the question of why we have so few of them. And in my view, this is undoubtedly because we insufficiently value such systematic evaluation in our research systems, and also possibly because of how we define failure and how we don't admit that there is so much to learn from it. We also heard a great deal about the need for cross-disciplinarity, the collaborations, cross-disciplinary, and I would say cross-sectorial collaborations, and inclusion of the widest possible set of stakeholders in projects co-creation, but also an engagement. And so this session brings all of these points together. So we will hear from Joe Torres from Grand Challenges Canada on how the organization is supporting innovators in low and middle income countries while encouraging collaborations. We will hear from Caroline Costongs from EuroHealthNet, who will provide insights from the context of a wider society. We will hear from Gila Neta, who will talk about the methodologies and justification of implementation science, and also from Elena Villalobos Prats, who will share the WHO's perspectives and a few specific on-the-ground examples. As with previous parallel sessions, following their presentations, interventions, I will engage them with a few questions, and then it will be over to you. So please think about questions as they are presenting, and we, of course, have an hour together. So without further ado, I want to hand over to Joe, who is the Director of Funder and Partners Relations and Executive Director of Grand Challenges Canada Foundation. Joe.
Wonderful. Thank you, everybody, and good morning. And thank you for that ambitious task to talk about how we turn this work into action. So really, that's what our objective is today, is to figure out how we actually take all of the needs that we know have been well-defined and actually move them sort of into place. So very quickly, Grand Challenges Canada is an independent not-for-profit based in Toronto. Our hope is that we help scale bold ideas to have big impact in the world, focused on low and middle income countries around the world, providing grants at the seed kind of early stage up into the point where they help transition them to scale to reach a point where they can then start to influence and be accepted into the health systems and provide impact into the communities that we care most about. We've been around for 13 years and have funded 1,400 projects around the world in about 100 countries. And so we have some experience in kind of helping to do a little bit of this work with our work having reached almost 2 million people with the sort of services that are being accessed by sort of end users, as well as anywhere from 20 to 64 million people benefiting from the technologies that have been developed from the programs that we run. And we operate in 3 spaces across kind of traditional global health and international development. We work in a program focused on providing solutions for those currently experiencing conflict in humanitarian settings. And we also work across the domestic Indigenous community in Canada to use a similar model to spark innovation and bring new ideas in that are locally led, that are locally supported, to make sure that those ideas are coming from the communities in which they're hoping to be delivered in. So climate and health. So I'm probably the least qualified on this panel to talk about the topic, but I think what's exciting about climate and health is it's an area that everybody, there's interest there, there's attention, there's some momentum. And so how do we think about this in the context of the work that we do in supporting better health outcomes? In partnership with the South African Medical Research Council, we launched a call in October 2022 to really invest in locally led innovations in the intersections of climate and health, a bit as a landscaping exercise to see what kind of ideas are out there and also what kinds of interesting areas are emerging in terms of priorities within the health domain with respect to climate impacts. To our delight and surprise, we received 772 applications, 75% of which were from the African continent. So lots of really exciting proposals coming in into geography that we very much care about. And we've funded 41 projects with $150,000 to test and validate their idea. So for us, it's really seeding interesting ideas across these domains, making sure that funding is actually getting in the places that are going to be implemented in these communities that are hopefully going to be benefiting from these interventions, and really stimulating some energy and excitement and making sure that we're engaging communities in a way where they're actually able to access funding. And that's something we really heard through the past 2 days is there's a lot of funding available. Funding can tend to be siloed, and also it's less accessible to those communities closer to the biggest climate impacts. So how are we as a funder community actually making those opportunities more accessible? So I'm excited to hear more from all of you on how we can do that together. Thank you.
Thank you very much. I will save questions for later. I now want to turn to Caroline, who is an experienced public health
Yes, thanks a lot, Magdalena. It's a pleasure to be here. Indeed, EuroHealthNet is a partnership of national public health institutes and national and regional health authorities, and we try to reduce health inequalities through the social determinants of health and environmental determinants of health. Oh, sorry, thank you. And we participate in several Europe Horizon projects. One is Blue Adapt, where we look at the impacts of climate change on health through water, so coastal waters, the quality of coastal waters, of rivers, and raising awareness. Raising awareness is important. We are based in Brussels, so we monitor very much European Union policy making and try to identify windows of opportunity to put the research results and the evidence into policy making, which I think is a very important thing to do. I would like to make 4 points when we think about implementation research. One is, it's a more generic point actually, in the debates on climate change and health, is that we should sort of steer away from a more narrow focus on disease-oriented healthcare systems, but look more into health-promoting health systems. We know that public health, health promotion, disease prevention have a lot to contribute, and we widen the scope of solutions if we look at climate change adaptation and mitigation. My second point is that when we look at the solutions, we have to look more into the way how our economy is shaped. And I see already here the slide up, which is the donut economy model of Kate Raworth. You may be familiar with that, but at the moment the economy is exploiting people, exploiting our natural resources. It's not serving humanity, no? So we want to see an economy that has a very strong social foundation, which is the inner circle, let's say, of that donut. The green donut, that's the safe space of the economy that we would want to have, an economy that's also not overshooting planetary boundaries and working with the natural resources that we have. I like this model. Someone spoke this morning about a vision. We need to have a vision. And I think a vision of a well-being economy, an economy that serves the planet, that serves people, is one that we should strive for. And implementation science is important because why are we not getting there? You know, what are the barriers and what can we do to make sure that the policies and actions are going towards that vision. A third point I want to make, and it's related to this and related to health promotion also, is that we need to change behaviors of us all. Behavior change is important, and we want to have people that live sustainable and healthy lives. And how can we do that? We know we can do that by focusing on capacities and capabilities of people to change their behavior, on their motivation to change their behavior, and also they need to have opportunities to change behavior. But this is easier said than done. We worked in a project called Inherit, which is also a research project of DG Research, and there you can't really see it, but we included behavior and cultural insights into this model. So the blue bubble are the drivers for climate change and health. The red bubble is health, and the green bubbles are the environmental pathways, so from the drivers to environmental stresses to health. And we placed in our project the behavior change wheel of Susan Mickey into this model to see how behaviors impact our drivers, how behaviors impact environmental stresses and exposures, and how behaviors impact on health. And I would say that all the behavior, the implementation science efforts need to take behaviors of people into account. We also see it outside, the farmers, people are angry, people want to eat meat, they want to fly, they want to use their car. You know, that is no longer possible, really, in the extent that we are doing it now. So it's important, one of the most important questions, I think, that we need to take into account. My final point is about a policy. Health promoting health systems, the economy, behavior change, this is all very, very sensitive and very political. So we don't get there with an infographic and, and a nice communication to policymakers. No, we really have to see what are our messages, how do we frame our messages and get engaged in the political debates in order to get our messages across. And I will leave it here, Magdalena.
Thank you very much. Some really interesting threads emerging there already that we will be exploring. So next, I'd like to call Dr. Gila Neta, who's an epidemiologist, program director for implementation science in the Office of the Director in the Division of Cancer Control and Population Sciences at the National Cancer Institute. Over to you.
Great, thank you so much. So with this talk, I just want to offer two things. So first, building off of what Caroline said, offer some methodology behind what is implementation science, because I think after yesterday's plenary and the call to action for, oh, it's advancing without me advancing it. I can't remember what I was saying, but the call to action for the importance of evaluation and stakeholder engagement or engagement, co-design, really, co-production. So what does that mean? And in implementation science, that's a lot of what we think about. So briefly, I'm just going to offer some methods to scratch the surface. The other thing I'm hoping to do is to remind everyone the importance of questioning our assumptions. And when we're assuming about and making assumptions about implementation, but in general. So briefly, I'd like to question my own assumption and ask, how many people in the room are implementation scientists? Please raise your hand. I know you are. Okay, thank you. Great. Okay, so there are some. The good news is you guys are going to have a very busy and productive next 12 months. I'm thinking about the speaker yesterday who said, what are we going to do over the next 12 months, not just at the end of the conference. The bad news is you may already know a lot of what I'm going to say, but I'm inviting you to think about maybe better ways to communicate it to our colleagues so we can spread the message, because I think this is a very needed area. So what is implementation science? I know everyone in this room is familiar with health intervention research, and where we're really focused, and especially in climate and health, what are the approaches, what are the evidence-based interventions, what are our adaptation efforts that will impact health outcomes? And we know it's very critical to understand these, that we want effective strategies to do so, both to adapt to and mitigate. But what we're skipping over, if we're not thinking about this middle, is how are we going to deliver those things? And how do we know that those health effects, if we're looking to see, are we making a health impact? Is it because the things we're doing aren't working, or is it because we're not implementing them sufficiently? So that evaluation piece of evaluating our implementation efforts, but also how can we improve those efforts? So in implementation science, we're really focused on that middle pathway of how can we improve the implementation and how do we know our efforts to improve implementation are working. We want to ensure that our interventions, our early warning systems, our whatever the intervention is, that it is going to be feasible to the populations, not just receiving it, but also the implementers who will be delivering it. We want to ensure it's acceptable, both, again, to the recipients and the implementers, that they have the supports in place. We want to make sure it's actually adopted and that it's implemented with fidelity. And so these implementation outcomes that you can see here are just examples of the things we can measure when we're evaluating the implementation efforts of our adaptation or mitigation strategies. And these service outcomes, these are essentially, we want to ensure that if implementation is effective, we'll be seeing things like that things are being equitably distributed, impacting vulnerable populations, not just those who are most highly resourced and have the most access. So these are the sorts of questions that implementation science addresses and some of the measures we use. So to questioning assumptions and sort of why implementation science, we know our adaptation or mitigation efforts are only going to be as good as how and whether they are adopted, not just by the end users, but by the implementers themselves. Can these early warning systems, for example, can the people who will be taking the data, inputting the data, communicating the messages, all of the steps that are involved, can they actually adopt the system? Can they be trained to deliver the program, intervention, whatever it is? And we know training isn't enough in and of itself. Can they be supported to use the program, have technical assistance? So these things I'm mentioning are the types of implementation strategies that implementation studies are focused on and ensuring that it is actually enabling successful implementation and sustainment. And finally, even if they're supported to deliver it, is it truly reaching vulnerable populations? Can we make sure we're also focusing on access? And so if we're just assuming these things will happen without focused attention on looking at them, and let's say it's only 50%, and that would be a huge effect in and of itself, we still would only have a 6% benefit. So when you look at each of these steps. So that's, I think, why there's such a call to action in climate and health to focus on implementation science. So finally, I'm probably out of time, but I just wanted to leave you with this sort of summary slide. And this comes from a paper, so this is why I don't have to say much about it. Chris Ebi was involved with this, so you can rest assured it's a great summary of implementation science and climate adaptation. But essentially, it was an effort to outline what can implementation science offer to climate and health adaptation research. And the one thing I want to really point out here, because I already touched on strategies and implementation outcome measures, but the theories and frameworks. So we know there are a range of barriers that we're facing when we're trying to, whether it's trying to impact policymakers or practitioners or implementers to begin. But in order to come up with solutions, we need to understand what these barriers are. What are the problems that we're facing? Thank you. I guess my time is out. And so there are a range of implementation science theories and frameworks. Many of them have been borrowed from other fields, and some have been created from within our own field. In this paper, we use the Consolidated Framework for Implementation Research, which essentially focuses on the inner setting barriers, the outer setting barriers, and understanding what those challenges are. And finally, just on the co-production topic, one thing I've been dying to sort of say is, why is co-production so important? Well, when you're thinking about implementation, the people who you're co-producing with They know the processes, they know what's happening on the ground, they understand the context, and these are all critical to develop effective interventions that can truly be feasible and acceptable. So, sorry, I probably went over time, but happy to entertain questions at the end, and my email is here for follow-up later.
Thank you very much, Gila. That was great. And my sense is that these mics are just going off randomly because I keep turning mine on and then it's not on anymore. So it's nothing to do with the timing. And the final set of comments will be delivered by Elena Villalobos Prats. She is the Technical Officer of Climate Change and Health at the WHO and is responsible for capacity development and country support for climate change and health. Elena.
Thank you very much. Can I take this, please? I'm not very original. Unfortunately, my slides have been used already. So I think I can skip. Basically, WHO has been working on climate change and health for over 25 years, at the beginning mainly trying to create evidence on the interlinkages. The work that we do is basically working with ministries of health. These are our primary audience. And since we are present in all the countries, basically we are quite well positioned to understand their needs. When I first started working with countries, mainly in Africa and Asia, kind of the response that we got from countries is, okay, I understand climate change is a problem, but either you tell me very concretely what I need to do, or I will continue dealing with my priorities, because we have the real diseases, we have dengue, we have malaria, we have many things that are quite important. So basically, we need to act. So thanks to what we learned with countries, basically we developed this operational framework for building. At the beginning, it was only climate resilient health systems, which basically took the building blocks of health systems, which are quite easily understood by countries, and then proposing specific interventions under those headings. So, for example, under information systems, we have all these assessments trying to create evidence on the impacts and risks from climate change, both in the present moment and also in the future. We also have basically working, integrating climate and weather information within the surveillance systems that are existent already for those climate-sensitive diseases that are a priority for the specific country. And then we have all related to service delivery, which is basically working with other sectors. Again, health is the business of everybody. So we need to work with the water, sanitation systems, just to make sure that the final health outcome is properly promoted. A lot working with the emergencies and disaster risk reduction, and also basically making sure that the health programs that are a priority in the specific country, under nutrition, infectious diseases, basically they understand how the information that they gather through surveillance is properly integrated into their programs, and the service delivery is really looking into that. So we've been implementing this for many years. We just updated last year to try and integrate the mitigation component in a manner that we still promote. The primary goal is quality of care, and making sure that countries have this systems performance, but then prioritize resilience while promoting low carbon and sustainability. And there are many ways to do so. There are many examples that have been raised this morning: waste management, procurement practices, without losing basically this priority that is ensuring that the care and the quality of care that they provide is perfect, basically. Something that I think is important to understand is when we work with countries, basically at the beginning they feel like, oof, this is too much, I don't have the capacity, we never did this, so basically they need a lot of hand-holding, and there are many experts in the room, Chris Ibai, Rachel Lowe, who have been doing a lot of that. But I think the most beautiful thing about this is after a while, when you are working with these countries, you realize that they took the ownership, they know what to do. And something that is important for WHO now is just to make sure that we continue building this real capacity at country, at regional level. We need much more support from the researchers, making sure that, for example, the models that they develop for surveillance, climate-informed health early warning systems are integrated and available basically for those that need to implement them and integrate it into their work. We now have the attach. My colleague Francesca also mentioned about it, and I think there is a great momentum and opportunity now. This Alliance for Transformative Action on Climate and Health basically convinced over 82 countries who have committed to building climate resilient and low carbon sustainable health systems at Minister of Health level. So they've committed to their own populations, and also brings together all the partners prioritizing climate change and health. So many of us have been working on this for many years. At the beginning, we were 3. But now we see all these partners and big partners and all these countries really trying to do much more on this space. And I think we all feel, okay, we just need to take this opportunity because it can really be the game changer. And we see that. So, yeah, I think that's it from my side.
That's terrific. Thank you very much. Let's thank our panelists, our speakers first. Thank you very much. That was great. So let me now dig a little bit deeper into the few thoughts that you shared with us. And I'm going to follow the order in which you spoke. So Joe, I'm going to turn to you. Thank you very much for sharing your insights. And it was really quite wonderful how you illustrated how through the call that you put out, you were able to reach researchers and also implementers on the ground in Africa. You spoke about the funding in low and middle income countries, but also indigenous people in your home context as well. I think these are quite different but very powerful examples. But let me ask you this. So research often unfolds at a different timescale from some of the crises that really require urgent solutions. And of course, the recent COVID example showed us how we can pivot when we really mobilized. And there were other comments made earlier in the plenary session this morning, how a crisis really focuses the mind and gives a motivation even to governments. But let's stick to the research. Is there something that we need to do differently in the sense of how we do research, so that researchers can provide more timely solutions in these real-life settings?
Yeah, it's a wonderful question, and I think it's something we think about a lot. I just wrote down, as I was hearing the comments, the urgency versus rigor balance, and how do we get that right? And for us, I think we try to operate on something a bit more time sensitive, where I think we try to provide funding in a way, but it's not just about the funding, it's about support to create measurement and evaluation frameworks so that there's appropriate measurement, but also because in the context in which we're working, there's just such a lack of evidence. So a lot of this is in itself sort of evidence generating to make sure that we provide some sort of local, real local evidence generation that can be helpful in kind of the aggregation of the data that's kind of going up to the ministerial health level and then kind of above there. And I think this is where we work together. And I think, this morning it was said as well, it's not just mitigation or adaptation, it's both, it's doing both, but it's also operating at different levels. So it's not just, betting big on a few kind of large organizations or large things, but it's about investing this way and sort of changing the model. And one thing that we're also working on at the organization more generally is how do we partner with organizations like WHO more on the demand side. So as these sort of models are elevated and as evidence locally is generated, how do we also make sure that these are assimilated into larger systems so that we have that happen faster? And I think that's the part where we see a very unique role in playing this to be able to sort of invest more directly and really working in complement. So I like to say a lot of the work that we do is a bit of air traffic control. So just knowing when the airplanes are landing and when they're coming in, as silly as that sounds, the best we can do that is important, and to make sure it's not just the big planes, it's the little planes as well that are part of this sort of configuration is really important.
That's a wonderful analogy, and you sort of, in part, answered my second question, and that's sort of the role of funders. But of course, if we're talking about how researchers themselves can play a greater role, a more relevant role in a timely fashion in this sort of air control traffic system, then it will take the whole ecosystem, right? So it will take the funders, it will take the evaluators, it will take the journals that I represent, and of course researchers themselves. And it's that our value system needs to be more diversified, right? As you say, it's not just the big planes, it's the small planes, and sometimes the small planes are more important than the big planes. Exactly. Thank you very much. I see the Slido questions have appeared. I'm going to hold them for 1 second because I'd like to ask my own questions as a prerogative of the moderator. And I want to turn to Caroline. So in your presentation, you set the issue of implementation science in the broadest possible context. You talked about the society, you talked about economy, the whole set of systems in which we exist. And of course, it's important to remember about this context. But in terms of actually influencing or contributing to implementation itself, or implementation science, which I guess my own distinction between implementation and implementation science is that sort of template, durable lessons that we can transfer from one instant of an implementation to another. How can civil society genuinely, actively contribute to that?
Yes, well, in various ways, because often civil society are really helpful in implementing, are implementers themselves. But I would like to stress here the role of advocacy. Because it was said yesterday, this morning again, that we should have more policy literate researchers, but that's not enough. I think that is underestimating the art of advocacy, because it's actually quite time consuming, because what you need to do, you have to constantly monitoring the policy debates. You need to know what the policy dossiers are. You need to network, you need to go to events, you need to see how the evidence that comes from implementation science, or science generally, how that can be fed into those policy processes. We talked about multidisciplinarity, so you have to frame your message and to package your message depending on the policymaker you talk to. It's very different messages for an environmental policymaker than a health policymaker or other policymakers. And with messages you are not enough, you need to also bring concrete and tailored solutions to them. And this is quite an art. And that is, I think, where civil society is good at. I mean, at EuroHealthNet, we do that in Brussels at the EU level, but also in member states, there are civil society organizations that are advocating in different ways. And I would recommend for every research project to bring on board in your consortium a civil society organization who knows how to do that, because that really contributes to the uptake, I would say, of the lessons from the research, and particularly from implementation research, because that's even more concrete for policymakers to take on.
Thank you. Speaking of concrete examples, can you share an example from something that EuroHealthNet has seen, maybe shepherded through, maybe in the context of health and sustainability, or health and climate, since this is our focus, of how the civil society is actually driving or making sure that the implementation is relevant?
Yes, we were part of a project of the Inherent project, the model that I showed you. And there we looked at various community that contributed to health and environment, like vegetable gardens or gardens in schools. So there are really a lot of activities out there, and we did interviews and focus group interviews, and we found actually a lot of great lessons that we then communicated to local policymakers and national as well, because you can do quite a lot by mobilizing community groups, by making sure that local strategies take on board the activities that are already out there, that local citizen groups are supported with some seed funding, or are supported with help of evaluation of the strategies, or provide platforms so that local community groups can exchange and can learn from each other. So there's a lot that can be done, and these lessons are very concrete and very relevant. So policymakers, and particularly local policymakers, they don't need to do a lot. I mean, already by taking away administrative barriers or legal barriers, they just have to build on the assets of the communities that's out there.
Thank you. That's a wonderful suggestion, that our jobs would actually be easier if we appreciated the assets. As you say, the assets are already out there. We're just not necessarily appreciating them and capitalizing on them sufficiently. Thank you. There's a theme developing here, which I'm going to ask you about in my second question. But my first question is, you actually very wonderfully started by ascertaining how many of us in the audience were engaged in implementation research, and there were some, but actually not the majority. So your presentation of the methodology and the approach was actually very helpful, I think, to many of us, certainly to me. My first question is, your focus on evaluation, the different aspects you talk about, how the feasibility, the acceptance, the adoption, et cetera. How translatable are these findings or these methodology approaches from one setting to another? And is there enough of an exchange in this context?
So thank you for the question. It's a great one. And in climate and health per se, I don't know that there is enough evidence to say, but certainly from healthcare delivery research and other areas, there have been systematic reviews and meta-analyses that have shown, so one implementation strategy that has been studied a lot is audit and feedback. And for those who aren't familiar, I don't know if, like our power company sends us every month information about how we're using our energy compared to other households similar to ours. And it's always great, but if it's ever not great, I always change my behavior. So it is an effective implementation strategy to change behavior, and I love Susan Mickey's work. I'm so glad that you cited it. But so there is generalizability of these strategies that we know work for a range of things and for a range of types of end users or people and systems. So does that answer your question?
It does, actually, and it's a wonderful example, actually relatively simple conceptually example of how feedback and comparison can immediately generate a change of behavior.
And I just remembered why I gave that example. So I just heard John Balbus give a talk, and for those who don't know, he is at NIH, and he's been a leader in climate and health for NIH, and Gwen, you could say more about who John is, but sorry to call you out. But essentially, he just cited some work that and there have been studies looking at healthcare systems and practitioners, and apparently there are efforts to evaluate audit and feedback. They are trying to do audit and feedback for reducing, for decarbonizing healthcare systems and how to get providers to be less wasteful. And apparently there are systems where they're testing out this audit and feedback approach, and it seems to be making an impact. So I did just want to mention that it does seem translatable for climate and health.
That's terrific. I wonder whether the speaker from Philips is in the audience, maybe. That was a relevant. It sort of connected with me to with the presentation that he gave at the plenary session, specifically thinking about many different ways of decarbonizing healthcare systems. I have a second question for you, Gila, and that is, and this connects with something that Joe was saying, and then Caroline also mentioned, the way you described elements that would add together to successful implementation effort illustrated to me how multifaceted and complex it was. There was support needed in many different stages in the implementation process in order for implementation to be successful. You know, for example, you talk about training at many different levels, supporting implementers on the ground, and so on. How well are these different stages of implementation efforts funded? And should we, in the context of the recommendations here that will come out of this meeting, should we be thinking about more directly lobbying, quite frankly, the funders to identify these different components that will lead to a successful implementation outcome?
So it is a great question that I cannot answer in terms of how well are these stages funded in practice. Certainly, so we're a research funding agency, and when our reviewers review applications and we evaluate the merit of whether we fund applications, we would hope that if you're proposing to study an implementation challenge, that you are thinking through these steps if your ultimate goal is sustainment or penetration throughout a system or whatever it is. So in terms of, I think that maybe the way I can answer the question is to say that as we're generating evidence to justify that it's important to fund these steps is just showing that it's not enough, and we've shown this in many areas, it's not enough to just train your providers or train people, but if they don't go back and do the thing for, you know, maybe they'll do it a week or maybe they'll do it a few weeks, but generating that evidence to show the importance of providing the reminders or whatever technical support, depending on the complexity of the intervention. I think we have a lot of evidence already to show that these steps are critical.
Thank you. Joe, I don't know, do you want to, as a representative of another funder, do you want to come in on this as well?
Similarly, I mean, I don't know if there's a silver bullet for this, but one example that I think helps a little bit with this is in the last 2 years, we've been working across our international partners globally with the Gates Foundation, with Science for Africa Foundation, and others to launch similar efforts. And what we've tried to do ourselves is actually align our efforts just within our own community, which doesn't seem like a lot, but across, there's been almost 2,300 proposals received across the nexus of climate and health over the last year and a half, looking at similar things. So we're trying to get ourselves organized in terms of what we can do, we can fund, but then also the activities around the kind of the supporting environment we can create so that these solutions then get assimilated at the state, local, national, subnational level, and to be able to sort of share those lessons. And it comes across, again, this, how do we work together? How do we translate these things? I think it's too easy to expect these solutions to be cut and pasted into different contexts, and I think that was always sort of the development formula of, oh, this works here, let's drop this here, and it's going to scale. In the end, I think we now are mature enough to know that solutions need locally tailored ways to make sure that they're implemented, they're long-lasting, and they're sustainable, and that we as funders and donors also have to, for the ones that show the most promise, really work hard to make sure that they get integrated at every level. And this is where we're trying to do experiments like with the WHO. We have an example where we're actually partnering with them on implementation of a mental health solution kind of across, where it's actually being more integrated, paid for through kind of local health systems to be able to provision that in a way that is long-lasting and community-led. So I think there's something here where we can share a little bit of those approaches and then figure out how we kind of align our activities so that we're kind of doing the most with what we can, knowing that the funding available is limited and the magnitude of the problem is always going to be way bigger than we can do individually.
That's great. Thank you very much. And actually, you set up my next question to Elena beautifully without knowing what I was going to ask her. And you talked about this sort of outmoded now cookie-cutter approach that, you develop a solution in one setting and you think you'll just be able to clone it and replicate it in other settings and it will just work just as well. So my question to you is, you work, as you explained, you of course work in many different contexts of different regions, countries, at different local levels. How much of what you learn of working with sort of actors on the ground is sort of clonable, translatable to other settings, and how do you really develop that sensitivity that you need to truly tailor-make approaches and solutions?
I think what is easily clonable is basically the tools, the approaches, because they are, at least for a specific group of countries, usually they are applicable. I think what is not really clonable is the specificity of each context. For example, we were listening Jan Semensa yesterday about what held true in the Nordic countries was not really so in Southern Europe. So either if you are going to support a country for them to develop a climate change and health vulnerability and adaptation assessment, and Chris has a lot of experience doing that, or you are going to support them to integrate climate and weather information into their surveillance systems, then you really need to work with them, to accompany them, for them to assess the sensitivity in the specific country. And there is a lot of needs. For example, if there is no real access to country-led information, if we think about climate and weather information, if the Met services don't have historical data sets, for the length that we need, then basically it's super difficult. There might be some data set that can be accessible on satellites, but then we don't understand if it is good for the resolution is good for the specific country, for vector-borne diseases. So there is a lot of things that needs to be tailor-made for the specific, and that's why it's so important to have the real capacity available to support those countries, to conduct the interventions that they need to do to accompany them and to make sure that this is also shareable. I think probably in countries that are nearby, if you work with, I don't know, Tanzania, Malawi, it's nice because they can share similar concerns, so it's easier for them to learn from each other, the Mekong, but then I think it's, at the end it's quite specific.
Mm-hmm.
So.
Yeah. Let me just expand on. Thank you. This time I really forgot to turn it on. Capacity building starts with a lot of hand-holding, but in the end, it's the local actors who take ownership. I think that was really quite powerful. And then you said that there was still more support from researchers needed. I sort of heard you say that maybe it's the local researchers who need to be involved and get an opportunity to be involved. Is that the right interpretation? Or in what way do you feel that there is a real gap, a real niche for that research, additional support from the researchers?
I think, as it's evident, I'm not a researcher. So basically, I come from the demand side. We understand what country needs. We work through our country offices to understand really what their needs are. We are not so interested in perfection, but in making sure that something happens at country level. And I think basically what is needed is to ensure that the capacity, because there's always capacity at country level, maybe environmental health, public health experts, that is still exists there, basically gets in touch with the expertise that is elsewhere. So of course they need to be accompanied, they need to build their confidence that this can be done, and they have to have this real access to discussions, sharing of experiences with the lead experts that are already out there. So I think something that is missing, because basically we hold the hands of these people And we are really interested now. We don't have the capacity to make sure that the real capacity, the technical capacity of all the countries, of all the regions is really built. But I think we should be, maybe it's a call to donors. And of course, every donor has its own priorities, but having this higher level overview or maybe strategy jointly defined by many that are interested in these areas of work to make sure that those spaces are built, no? Between the real expert, I mean, the leading experts for many years that have the knowledge that those countries need, is put together with the existing capacity at country level and the Ministry of Health, which is the one to tell them, I need this. So this is my completely biased interpretation.
No, that's all right. We'll take your biased interpretation. That was a very good recommendation, very good call. So let me turn to the questions from all of you. And the most popular question, the most upvoted question, I sort of feel is for me, actually, but I'm not going to answer it. Often implementation studies are hard to publish in scientific journals. How can researchers be encouraged to conduct and submit more implementation studies? Would any of my panelists like to take that question?
I guess one question is, are researchers submitting it to the right journals? And are people aware of which journals do publish a lot of implementation studies? So I don't know, but I know there is a journal, Implementation Science, and there is a journal, Implementation Science Communications, and there is a journal, anyway, there's 4 implementation science journals that I am aware of, but I also have seen a lot of papers published in JAMA and New England Journal, and so there's a range of journals that is interested, and yeah, so I guess I don't know if I don't know, you would know better than I would, if they have less success, or if it's that researchers aren't aware of the appropriate journals.
Meg, can I jump in and just ask something provocative? Because I think this is where it's really interesting for me as kind of an intermediary funder, right? That publishing is amazing because it's important for careers. It's important to sort of validate. That's really, really great. At the speed in which we're trying to operate, is that the time cycle that's going to get us solutions delivered in terms of what we need? Or can we, as a system, reward behaviors that actually share information quicker? Like publishing, of course, is important. I understand all of that. But can we think about this differently in this emerging area where before it was already too late and now it's even more too late to sort of get these things out there? So what are the other things that we can do in order to sort of facilitate that kind of sharing that I think would be really useful for us to kind of think about both at the funder level, but also at the international partner level, and how do we create maybe less formal fora for communication sharing or whatever, but I think there's an opportunity here given that there's a lot of alignment, and even just this morning and yesterday seeing the DGs come together, there's already this keenness for ministries to work together, so I think there's some magic here, and we just need to sort of figure out how we kind of make it work.
That's a really important comment. I would just say don't give up on publishing, obviously, because apart from the reasons that you mentioned why publishing is important, of course, it is a way of sharing peer-reviewed and therefore validated information, and that's what research builds on. And also, of course, scientific publishing can be reformed. And it's not a coincidence that I'm moderating this session. So if you're interested in talking to me afterwards, please do. I would love that. But let me move on to the next question. And so the question is really interesting, and that's a question about priorities. Which ways are there for us scientists to prioritize special vulnerable groups, such as pregnant women, children, when talking about implementation science? Is it possible to prioritize? Would anyone, Caroline?
Yeah, whether it is possible to prioritize it, that depends obviously very much on the context and on the research that you are doing. But generally, we heard also this morning is that countries already are not taking sufficiently on board the voices from various vulnerable groups in their climate adaptation plans. And also in implementation research, that is, I would say, the way to get those voices. So we need to take a very structured approach when we want to involve citizens or people in the research. And here are sort of 3 principles. They all start with an I, which I think is interesting to maybe share with you. The first one is inclusiveness. So who participates and who decides who participates in terms of gender, in terms of age, socioeconomic backgrounds, whether someone's pregnant or not, who decides on that and who do you include, and what are the incentives for them to participate? You really have to think that through. And also how you can use, let's say, multipliers or leaders of a certain group and to get them on board. The second I is on intensity. So how are you, what are the means? How are you going to bring them on board? How intense? What are the methods that you are using? So what is the extent of the interaction? And the third one is influence. That is how, what sort of decision-making capabilities do they have? Are they also able to decide on the design of the research, for example, or not? Or what is the influence that you want people to give for your implementation science? So it's important that it is not sort of tokenistic, but really well done. So in the Blue Adapt project that we are part of, there are some case studies. One case study is in Italy, in Lake Paula, which is between Rome and Napoli, and where we look into a tool to assess water quality of the lake, and residents and stakeholders are brought on board to develop the tool, and it's also a way to raise their awareness of climate change and health and how that works with water. We have some coordinators here of the Blue Adapt project, so if you want to know more about this, please come to me and I can introduce colleagues there. But it's a really great way to take a structured approach really to get, and to that helps also to prioritizing, I think, and not just a tokenistic exercise.
Thank you for that, and it's a really important comment to remember who is included and why, and who decides, and why would they want to take part, right? It's not just a matter that we, whatever the we is, include them, whoever they are, but why is that relevant? That actually makes me think of, there was an example in the plenary session yesterday about 2 communities living on the river and their engagement in the context of a crisis, and one community engaged and the other one didn't, and we all heard that the one who was engaged had a less bad outcome of whatever happened. And my question, of course, was how come 2 communities living on the same river, one engaged and the other one didn't? That was an interesting question itself. So we have time for one more question, and this is a 2-part question from Remy. Thank you for not staying anonymous. So the first part is, nice to ask how scientists can provide more timely solutions, but isn't it that scientific knowledge about climate change and its impacts have been blocked for decades? And in this context, another relevant question is to think about how to change the political system so it cannot ignore science for too long. There are many things wrapped up in these 2 questions, including interaction between 2 stakeholder groups, researchers and politicians and political systems, and a communication. Are we actually communicating in an effective way with one another? Would anyone like to make a comment to this?
Yeah, I'll be brief. I think that's important that funders realize that as I mentioned before, the art of advocacy, I mean, that requires capacity, time, resources, and that needs to build in the research. So indeed, when the research has produced the results, the political arena may not be ready yet to take on board the results. But it may be in a bit later stage, or maybe in a different format. We experience that sometimes the window of opportunity is there, and then we look actively ourselves to see what the research says and how can we influence the policy process. And also sometimes the other way around, we get the research evidence and we look actively, okay, where are policy hooks that we can use to put forward the arguments. But it is time consuming, and that needs to be credited and also brought into a research project, I would say.
Thank you. And Elena, can I put you on the spot? Because you described yourself before as a sort of a mediator, right? And the question really speaks to the scientific community, those researchers and political systems, and you sort of sit in the middle. Do you feel that political systems need to change, or we need to be more adaptable within the constraints that exist? Sorry to be putting you on the spot.
Well, for sure, political systems need to change. But with regards to this specific question, I think what probably is, well, again, my poor perception is that we need to make sure that policymakers also have the capacity to influence the evidence that is, I mean, the research questions. Because I think sometimes, of course, there is a little bit of a disconnection between what they want to know, and maybe, for sure, if we judge, maybe it's not the key priority, but there are very basic questions that can inform greater action on climate change and health, not only by the Ministry of Health at country level, but by others, even the finance ministers, if they have proper information on the cost of inaction or things like that, we can really change the way things are done. So yeah.
That was a great comment. Thank you very much. And we've come to the end of our time together. This was a session, of course, about translating research into action. And I think probably the most important thing that emerged from our conversation is, yet again, that this needs to be a collaborative approach, that there need to be all stakeholders at the table, that implementation can only really be successful if all of these stakeholders are engaged, and if what is being proposed is relevant to all the stakeholders. Your last comment actually was very appropriate in this context, because it's that how can research be more relevant in a more timely fashion? It's also about researchers themselves understanding which questions to prioritize at which particular point, so the flow of information needs to go in every direction. And what I also heard is that we need a systems approach. So perhaps more it's a reductionist approach of science, echoing a little bit of what we heard in the plenary session about public health in particular, that having more holistic approach as opposed to a reductionist approach will make implementation science more successful. Thank you very much to my panelists, Joe, Caroline, Gila, and Elena. Thank you very much to all of you. Thank you.
Thank you.